Hi everyone, my name is Amber and this is case study part 1 for SPCE 638 section 803. I've been an RBT for 3 years and I've been working in early intervention. The clients I work with range from 2 to 7 years old. Due to HIPAA regulations, I will be referring to this client as Client X. Topics that I will be discussing today are Client X's background information, the direct and indirect assessments used in assessing Client X's barriers and behavioral functions, why we choose to use these assessments, and the BCBA task list items associated with this presentation. Client X is a 5-year-old male who was diagnosed with autism spectrum disorder at 3 years old. He started ABA services in February of 2023. I've been working closely with this client since March of 2023. He's currently approved to receive ABA services for 35 hours per week. He engages in appropriate functional communication of his wants and needs, but does not consistently demand for the removal of peers and staff. He tolerates peer play for short durations with support from staff, and Client X relies on prompting from staff to consistently respond to peer initiations. Client X engages in noncompliance, aggression, and self-injurious behaviors. Client X was evaluated using the Verbal Behavior Milestones Assessment and Placement Program and the questions about behavior function. The VB map was chosen when the client initially started services. During his first evaluation, he was using 1 to 3 word MANs. Language was inconsistent and he did not always respond to peers or adults. He was an early learner with a limited verbal repertoire, and he was reliant on prompting from adults to respond to others. He would move away from the assessor when prompted to complete a task and would engage in yelling and hitting. Client X showed deficits in communication, social, adaptive, motor, and cognitive domains. The VB map helps tailor individualized intervention plans to address specific needs for the client and their barriers to learning. Both assessments do show a high reliability percentage. The QABF was chosen due to time constraints and staffing. The assessment is easy to use and uses a Likert scale. It is important to state that an experimental functional analysis is the only assessment to determine function of a behavior. However, due to ethical concerns about evoking a behavior that could potentially be harmful to the client or the staff, the QABF was chosen. On this slide, we can see the client's VB map milestones assessment. So the first one on the left shows the initial assessment done in February of 2023, where the client scored a total of 36. And then the one on the right is his current one that was done in July, so about 18 months, and he scored 135. As you can see here in the beginning, he had some deficits and was mainly completing in the level 1, where now we are looking at completing in the level 3. Here's our client's barriers assessment from the VB map. You can see here that he has a score of 2 currently in the behavioral problems, and then the reinforcer dependent and hyperactive behaviors he scored a 3 in. We can use, although the barriers assessment doesn't determine a function or doesn't show function, we can use this to guide us in implementing interventions in the adaptive domains. So teaching, tolerating of denied access, which could potentially be a problem for the client, but just using this barriers assessment for our adaptive interventions. Here we have the operational definitions for our behaviors, and again, they are noncompliance, aggression, and self-injurious behaviors. Noncompliance is any combination of verbal protest, throwing himself to the floor, whining, crying, kicking, eloping, and aggression, or SIB. Right now, the function is escape and tangible, which we will see on the next few slides for our QABF. Aggression is banging himself into you, hitting someone with an open or closed fist, shoving, pinching, attempts of biting or kicking, and then the possible functions, tangible and attention. And then our self-injurious behaviors, banging his head on the floor, wall, windows, or hitting himself on the head with his hands, and then those functions of tangible and escape. When we are taking data on noncompliance, we are doing frequency and duration. Duration will not start until 2 minutes of the noncompliance has been occurring. So it starts at 2 minutes for the duration timer. And then 10 seconds of compliance is when you stop it. For aggression and self-injurious behaviors, we are taking frequency data. Here are our results for our noncompliance from our QABF. You can see here that the hypothesized function is tangible with a possible secondary function of escape. So for tangible, those were the questions 5, 10, 15, and 20. And then for escape, it is 2, 7, 12, 17, and 22. The QABF does use a Likert scale. If it's marked in X, it doesn't apply. 0 is never, 1 is rarely, 2 is some, and 3 is often. Here we have our results for aggression. Our hypothesized function is tangible, a possible secondary function of attention. So again, same thing, Likert scale, tangible scored the highest at 15, and then attention, it looks like it was scored at about 11. And then here's for our SIB with a hypothesized function of tangible with a secondary possible function of escape. And then again, you can go ahead and read those questions, and tangible again looks like it's the highest at 15. Here on this slide, we can go ahead and see that the BCBA relevant task list items establish operational definitions of behavior, which we did with the noncompliance, aggression, and SIB. Distinguish among direct and indirect and product measures of behavior. So of course we had our direct and indirect earlier with our VB map and our QABF. Our measure occurrence, again, our behaviors were all done in frequency. However, the temporal dimension of duration was also done for noncompliance. Evaluate the validity and reliability of measurement procedures. Of course, both the QABF and the VB map have high reliability. Now for validity, we need to make sure that the person, the assessor, is trained in doing those procedures. Select a measurement system to obtain representative data given the dimensions of the behavior. So we want to make sure that our behavior matches the dimension when we are taking our measurement, which frequency for all three is a good one. Review records available. So before this presentation, I did go over with the BCBA assessments from the parents, indirect assessments, and concerns. Determine the need for behavior analytic services. This client is a good candidate, autism spectrum disorder. We have those socially significant behaviors for behavior change. Identify and prioritize socially significant behavior change goals. Again, aggression, noncompliance, and SIB. And then we can use the barriers assessment for the adaptive skills that we can implement and track. Conduct assessments of relevant skill strengths and deficits. VB Map does a great job doing the milestones assessment and then as well as the barriers. Conduct preference assessments, so making sure that we have motivation for our clients to run the interventions. Describe the common functions of behavior, so we have escape, tangible, sensory. Escape, access, tangible. And then interpret functional assessment data, which we did for our current slides. So we go ahead and look at that for our next case study. So conclusion, we went over the VB map and the QABF for this client. Those are the two assessments that we use. The VB map is a direct assessment used to guide the clinician to program specific goals for the client. Our QABF is an indirect assessment used to determine possible functions of behavior and guide the clinician in their research to find evidence-based interventions for socially significant behavior change goals. And then we identified our behavior for functions, noncompliance, aggression, and SIB. I hope you guys enjoyed today's presentation, and I hope to see you in case study part 2, where we will discuss evidence-based interventions for the client's noncompliance, aggression, and SIB. Thank you.